What are the main TB risk factors to understand? Imagine a tiny bacteria that can quietly hide in your body for years without causing any symptoms. That's how tuberculosis often begins. But certain factors can make you more likely to come into contact with these bacteria or develop active disease once infected. Understanding these risk factors helps us stay ahead of TB and protect ourselves and our communities. First, exposure-related risks are key. Spending time with someone who has active tuberculosis is a major factor. This is especially true if you share close, prolonged contact like living in the same house, working together, or socializing regularly. The bacteria spread through the air when someone with active TB coughs or sneezes, so the longer and closer the contact, the higher the risk. Traveling or living in countries where tuberculosis is common also increases your chances of exposure. Many parts of Asia, Africa, and Latin America have higher rates of TB, so people from or visiting these areas should be especially cautious. Living or working in crowded settings like homeless shelters, prisons, detention centers, or long-term care facilities can also raise your risk because the bacteria spread more easily in these environments. Healthcare workers who care for patients at high risk for TB are also more exposed and need to follow strict safety protocols. Next, health-related factors that weaken your immune system play a big role. If you have HIV, your immune defenses are severely compromised, making it much easier for latent TB bacteria to become active. People with diabetes are also at higher risk because their immune response is less effective. Other conditions that weaken immunity include certain cancers, treatments like chemotherapy or corticosteroids, and viral hepatitis. Young children under 5 are especially vulnerable because their immune systems are still developing. If you are immunocompromised, even a small exposure can lead to active tuberculosis. Behavioral and social factors also influence risk. Smoking tobacco or vaping damages your lungs and impairs your immune response, increasing the chance of developing active TB. Alcohol and substance use disorders can weaken your immune defenses and often lead to risky environments where TB bacteria are more common. Homelessness or unstable housing situations often mean limited access to health care and increased exposure to crowded, unsanitary conditions, which heighten the risk of infection and disease progression. Other important considerations include recent infection. If you have been infected within the last 2 years, your risk of developing active TB is higher. Past treatment for latent TB or active disease that was incomplete or inadequate can lead to recurrence or drug-resistant strains. Drug-resistant tuberculosis is a serious concern because it is harder to treat and often results from improper use of antibiotics or poor adherence to treatment plans. Knowing these risk factors helps us identify who might need testing or preventive treatment. If you have one or more of these factors, it's wise to discuss with a healthcare professional about screening for tuberculosis. Treating latent TB infection in high-risk individuals can prevent the disease from developing and help stop its spread. Always remember, if you're concerned about TB or think you might be at risk, consult a healthcare provider for personalized advice and testing. Staying informed and proactive is the best way to protect yourself and your community from tuberculosis.